was an actual FDA approved injectable called, I think it's called QWO.
Quo. Yep.
Quo. According to Dermatology Times, it was approved in 2020, and it used an enzyme, as I understand, to dissolve the septipans that are
Mhm.
responsible, as we know now, for cellulite. And it was pulled from the market after leaving many women with severe, long-lasting bruising. And I almost got it. I was talking to a clinician and saying, "Hey, I want it on my thighs," and she said, "No, it's not approved for the thighs." I'm like, "Come on, you can do it on my thighs." But I'm so happy because I went back to my other clinic and one of the injectionists there did it, and she had a big, huge purple bruise that we're told will never go away.
Yeah, so I can actually speak pretty personally to this. This is something that we offered back when it first came out because, again, we do a lot of body treatments, definitely, especially treating the butt and thighs. So I actually have received Quo personally, and it's something that we offered at the practice. We were super excited about it, in theory, and of course, it was FDA approved. That the thought behind it is the enzyme is going to attack that specific type of fibrous band and help to dissolve it. But the problem is it also attacked, the areas surrounding the vessels, which created some leaking, AKA huge bruising. We're talking insane black and blue, so dark. And it's super unfortunate that it didn't work because it was very convenient. A few quick pokes, easy procedure. And the very unfortunate thing is I actually did see some women with good results. We saw some good results, but definitely not everyone. It wasn't as reliable. And like you said, some ended up with super severe bruising, which did typically go away with time, but sometimes it took some extra treatments to get rid of. So I'm thankful that we have some better solutions now for sure.
Like Sarah Viebrock is a cosmetic nurse injector at Austin Plastic Surgeon and a national trainer and speaker on cellulite treatment. Coming up, she reveals the one thing every failed treatment had in common. Sarah, welcome back to Beauty Seek.
Thanks so much for having me.
Sarah, you train other providers on cellulite all over the country, which means you've watched treatment after treatment come and go. Tell me about a patient who came to you. They tried everything, spent real money, and then still had the dimples. What did that feel like for her?
It can be super defeating. As we know, cellulite is something that affects our confidence, and we can really get down on ourselves about it. I had a patient that specifically came. She traveled. She drove several hours. Luckily, was within driving distance. Came in really just wanting to treat her cellulite, but for her, she had to be in her job actually required her to be in a tiny bikini pretty regularly. Her and her husband did some boat racing. She needed to be feeling super confident, super fit. She is someone who is in the gym every day, looks fantastic, but had some of that very traditional central buttock cellulite that drove her crazy. You could see it through her clothes. So we together came up with a treatment plan that involved a couple different things and resulted in a super optimum, beautiful outcome, 100% non-surgically. And she looked fantastic. She felt great. So it's all about that confidence that they end up with. But of course, the before and after is great too.
Oh, good. I'm happy for her. That's fantastic, especially if you're bopping around in a bikini.
Right? I know. I know.
Let's start with the shelves full of products. According to the Cleveland Clinic, no cream, scrub, or wrap can actually get rid of cellulite. On a scale of 1 to 10, not very much to quite a bit. How much money do you think the average woman you see has spent on products that were never going to work?
I think quite a bit. I mean, typically at least hundreds and sometimes even into the thousands if they've tried those, wood wrapping, scraping treatments or cupping or something where you have to go back time and time again. But I know a lot of us, even myself included, before I got into this, have purchased things in the middle of the night while you're scrolling Instagram or Facebook and you fall for some ad with some fake before and after telling you that this is what's going to finally fix your cellulite. So I think most of us have probably done that in the past. So it honestly can result in quite a bit of unnecessary spend.
Yeah. I did wraps. Oh my gosh. It was so hot. And then what's the tool? Ultrasound. Then they kind of rubbed an
Mhm.
ultrasound over me, and I was
Yep.
losing weight at the time. So I think I thought it worked, but I don't think it
Mhm.
did.
Yeah. 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 As I've mentioned before, sometimes it will create like a little bit of temporary inflammation, enough for them to be like, see, it looks great. And then within a few days to a few weeks, all of the cellulite is back because we didn't treat the root cause.
Mm, been there numerous times. Mm.
You're not alone, but sometimes it took some extra treatments to get rid of. So I'm thankful that we have some better solutions now for sure. Women
Times.
have been burned in the past, whether they tried whether they tried the lotions and potions and creams that they've ordered off Facebook, whether they tried, you know, like you said, wraps, ultrasound treatments, something like that. So it really is taking a while to win back their trust and explain why those things didn't work. The beauty of, I think, today's world in aesthetics is that we do understand the anatomy of the buttock so much better than we used to in the past. And once you can actually, create this visual for women of what that fibrous anatomy looks like underneath the skin, and explain how we can actually get rid of the bands, why certain treatments work better than others, then it's pretty easy to wrap your head around, but you need to see it and visualize it. So we're getting there. I can see everybody kind of, obviously my treatments are growing every day. So we're getting that trust back. We're creating some really optimum outcomes, but it's taken some work, of thankfully people like you helping to educate women all over the world on why things haven't worked in the past and why we've got a good solution now.
Great. Well, I'm so excited. Let's talk about it. We know there are many false ways that just don't work to get rid of cellulite, but now there's a real proven way. Can you tell our Beauty Seek community what it is?
Absolutely. So, my number one favorite way to treat cellulite is using a wand called Ovally. So, Ovally is one of the first and only FDA approved treatments to get rid of your cellulite fibrous bands in a one time procedure in the office. So, at Austin Plastic Surgeon, we do Ovally procedures awake in office. They can be added onto surgery too, but most of the time, if they're coming in just for cellulite treatments, it's a quick awake in office procedure. Now, I know the word procedure can sound scary, right? But if you've tried lots of other things to treat your cellulite that never worked before, then you are typically willing to try anything to get a long lasting solution or a long lasting outcome. The way it works is we do injectable numbing to flood the whole area where you've got cellulite. So think about this. When you're standing, you can see your cellulite, right? When you lay down, you really can't, right? Where, gravity is what's pulling on the skin and pulling on those actual bands, right? And creating that indentation. So the first step is going to be walking you through the treatment. I'm going to mark out all your cellulite dimples while you're standing. You and I would go over the treatment or procedure together in front of the mirror to make sure we didn't miss anything, make sure that we're treating exactly what you want. And then once we've got that marked, we're going to flood that whole area with some injectable numbing. That injectable tumescent fluid is what it's called, is going to help block your pain nerves, and it's going to help get some of the blood out of the area. So it's surprising, but bruising with Ovally is actually substantially less than what we saw with something like Quo, even though we're actually using a wand to go up under the skin and release those bands. Please come find me on Instagram. I have tons of videos. Sarah Injects Austin. But we're going to make a tiny little opening in the crease of the booty, right? In that fold that we already have. So it hides really well. Less than a centimeter, less than the width of my pinky nail is what I always say. And now that you're good and numb, you're just going to feel tugging, pulling, and pressure. We go through that tiny little opening. We use the wand, which has a hook at the end. Until I'm ready to use the hook, it's put away, right? So you deploy the hook, pull back, catch the bands. Now I can recreate your dimples by pulling on those fibrous bands before I cut anything. And that's the beauty of Ovally, is it's selective, right? So we're going to use this little hook, catch the bands, pull back. I'm using our markings that we made while you were standing as my guide, right? And then it also has a little bitty light where I can see through the skin. So I know exactly where I'm working. If I'm catching bands within the markings, then I'm going to deploy the little blade, go ahead, pull through, and cut that band for good. Once we treat it, it should be gone for good. Now, there's never just one fibrous band underneath each cellulite dimple. There's a whole web of them underneath each dimple. So we'll go through right to left, release that whole dimple. And then this is the best part, is the verification. So I'll use that same hook to slide through under the skin, make sure that now I can slide through like butter. I'm not catching any more bands. It's super satisfying, honestly. And that's how I know you're going to get a really good outcome, because I'm not catching any more bands underneath those markings while you were standing. And the beauty of this is I'm leaving everything else alone. Nothing's automatic. Everything is controlled by me. So we know that we're leaving that structural support around your cellulite there. We're just getting rid of the bad bands, creating those indentions so that the skin can smooth back out.
Okay. So I'm going to go back to my fence post, holding up my four fingers here. So,
Love it.
so the wand
Mhm.
comes in. It's almost like a
Mhm.
latch hook, maybe in my mind, where it just kind of grabs it and just just
Yeah, that's a good way. Yeah, absolutely. And that's the thing. So it's literally just like a little wand at first, right? Because the hook and everything hides within the wand. So
okay.
tiny, like it looks like a kind of like a needle, but it's not, right? It's a wand, the blunt tip, no needle. We deploy the hook when we want to, catch the bands, make sure we're where we want to release. If we are, we pull through and release. And then we use that same little hook to make sure everything's nice and smooth. And then we move on.
Of that. Okay, how long have you been doing this? Like, what do we know about longevity of this? Will they grow back? So many questions.
Yeah, we've been doing Ovally since it was released, which has been, I want to say, almost 4 years now. It's been quite a while. And in aesthetics, I'm sure you know this, we can't say anything is permanent, right? Legally, you can only say something lasts as long as it has been FDA approved. But when I see patients years out from their treatment, the beauty is we do not see that cellulite coming back. Now, one thing that's super important, and I know we're going to get into it, is I can't stop you from aging. So that skin has to be maintained. One of the things that I see all the time is people confuse loose skin with cellulite. So if you want to maintain that nice smooth booty, you are going to need to do some skin tightening over time, because as we age, of course, you're going to see some sagging to the skin, but you will not see that deep dimple from that fibrous band come back. So yes, long lasting treatment. That's kind of the best way I can describe it. Through with a little hook, release, and then everything can be nice and smooth.
Yeah. The one that I saw that was on your Avali hook was so strong. I mean, you couldn't even break it with your fingers from what I was seeing. And
Right.
I mean, that explains to me why the vacuum treatment didn't work. No
Right.
vacuum's going to be breaking those up.
Right. Yeah, exactly. Yep. You got it.
I mean, the before and afters are legit. There is no denying that this is a huge improvement.
Hmm.
And you know how sometimes you can see before and afters is like, well, they're in a different light. Well, really, they look
Hmm.
like you filtered it.
Hmm.
So I'm the biggest skeptic now, having been through numerous treatments, but also now the biggest believer. So I'm so excited.
Yay. I think is important to point out is we're only releasing the bands causing a problem. We're able to use that little hook to verify that we actually got them, and then leaving all the structural support around it alone. So there was some research that they got to kind of piggyback off of and kind of figure out what's worked well in the past and what didn't work well with that.
Okay. And that risk that you're talking about is if we release too many bands, then we might have saggy skin more so than we might. How do you know not like where to stop in terms of cutting the bands?
Yeah, and that's where the marking is so important. And also differentiating between loose skin and cellulite, right? So when say I'm consulting a woman in the treatment room, we're literally going to be in front of the mirror together. I'm literally pulling up on the skin, kind of explaining the difference. So if I pull up on the skin gently and the dimple completely goes away, then it's naturally just loose skin, right? If you're over the age of 30, you have some loose skin on your body body and you understand if you pull up, it looks smoother, right? Our knees, for example. Now, if it's true cellulite tethered by those fibrous bands, if I gently pull up, it's still going to be there. And that's how you know the difference. And I would say, especially in today's landscape of so many women losing weight, whether on GLP-1 medications or, in any other form or fashion, I see a lot of skin laxity. So that's where it is important to find a provider that's experienced, that knows the difference, is going to explain to you, what treats what. And then it all falls back on your markings. You're not releasing anything outside of your markings. You're only releasing right underneath that cellulite dimple. And I know because I treat cellulite, but I'll explain to you, there's so much structural support and fibrous bands underneath the skin that we just have to leave everything else alone. As long as you're only releasing, underneath that little dimple, then you should be good.
Okay, great. And is it approved for the booty, the thighs, the arms, anywhere on the body, or just certain areas?
Definitely the butt and thighs.
Okay.
I'll tell you when patients, and I do sometimes have patients come in saying they have cellulite in their arms or their abdomen. And I would say the chance of that is honestly very, very, very slim. It's almost always just loose skin. So it's very, very rare that we would use Ovally to release or treat something in like the arms or the abdomen or something like that. It's
Okay.
almost always, because we're so lucky as women, that cellulite is almost always in the butt and the back of the thighs, sometimes the sides of the thighs. Very rarely, I will sometimes have it on the front of the thighs where I will release a little bit. But even on the front of the thighs, we're built totally different. It's almost always loose skin there. Now we do a 360 treatment where we're often tightening all the way around the thighs, but typically on the front side, we're doing skin tightening versus cellulite release.
Okay, great. Um, Fantastic. And now I just thought of, the investment. What's the appropriate way to charge? Like by band that you release or the area or the time, or what should a beauty seeker expect in terms of how someone might charge?
Great question. And everyone's different. Since we train on this, I get to work with a lot of different providers, and everyone does charge differently. Obviously, it totally depends on the practice. At APS, we've kind of just settled on a flat fee for our time. So because I don't, in the past for other treatments, there have been different pricing for like this many dimples or it increases for more. I don't want you to have to decide what you're treating because of like a financial reason. Does that make sense?
Yeah, it
So
does.
if you're coming in for cellulite treatment at our practice, it's just a flat fee and I'll treat all of the dimples that we can find within that, procedure. And
Oh,
for us, that's worked really well. Some people it's faster, some people it takes longer, but it all kind of comes out in the wash. And our, most important goal is just that everyone gets a good outcome.
oh my gosh, Sarah, thank you so much. I mean, you just explained why so many women like me gave up, ever smoothing their cellulite. And then you reeled us back in by introducing us to this treatment that literally, I mean, it's eliminating the root cause of cellulite. To stop
Absolutely. One of my favorite topics. Thanks so much for having me.
beauty seekers, here's what to remember. According to the Cleveland Clinic, creams and wraps can't get rid of cellulite. And according to Dermatology Times, the one injection that tried to dissolve the septi bands that cause cellulite was pulled from the market because it actually arguably caused something worse, severe and sometimes permanent bruising. We now know that what finally works is releasing the septi bands, which are the cause of cellulite at the source. Beauty seekers, before you spend $1 on treatments like cellulite elimination, get educated from experts like Sarah Viebrock, national cellulite trainer at Austin Plastic Surgeon. Every Beauty Seek subscriber helps us to keep bringing aesthetic experts like Nurse Sarah directly to you. Coming up next, releasing the septi bands, which cause cellulite, might only be step one, depending on your body type.
So say you're coming to Austin Plastic Surgeon, we're looking for a non-surgical solution for skin tightening. And actually, this is probably these days 80 to 90% of my ovule cases, I'm combining with something for skin tightening, because most of us have lost weight, been on a GLP-1, or are just naturally aging, right? So that is the big majority of my patients. And we have a couple different ways that we do that. So if we're looking for non-surgical skin tightening, I am going to likely start with a device like maybe